Welcome to Medical Logistics 101, leg swelling patient scenario. Going to be changing the pace a bit with my presentations. I'm going to try to focus on some patient scenarios of things I've seen over the years to try to illustrate some clinical points and things to watch for. This video is for educational purposes only. It is not medical advice, does not replace a medical evaluation, and may not apply to your situation. If you have symptoms or concerns, please speak with a licensed healthcare professional. My goal is to help patients enter healthcare with a map instead of a blindfold, and to explain how clinicians think through these problems in resource-limited settings. Background story. 58-year-old warehouse worker presents to urgent care with left leg swelling for 3 days. He has no primary care access and hasn't been seen in years. He attributes the swelling to working long shifts on concrete. He almost didn't come in today, but his wife insisted. Setting. This is an urgent care clinic. It's late in the afternoon. Limited diagnostics are available. There's no ultrasound. There's no D-dimer for lab work and no CT scan capability. In this situation, if the clinician is concerned the patient may have either a deep venous thrombosis or a pulmonary embolus, they're going to have to send them to the ER in all likelihood. The question you ask is, does the ER have ultrasound on call? I always tell patients, does the hospital have a labor and delivery department? If they do, they likely do have 24/7 ultrasound. Symptoms: my leg feels tight. It's been getting bigger every day. No injury, I just thought it was work related. I get a little winded on stairs, but that's normal for me. I've heard these statements many times over the years. Key point here, no chest pain at this time. Vitals: heart rate 102, blood pressure 138/84, respirations 20, temp 98.7, pulse ox 95% on room air. It's a little low, but nothing very alarming on those vitals at this time. Physical exam: left calf visibly swollen compared to the right, warm, mildly tender, pitting edema is present. Important point, no erythema tracking up the leg, so no signs of cellulitis, no open wounds, palpable pulses at the left foot, very important to always document that. Lungs are clear on auscultation. Heart tachycardic but regular, and that's kind of common with pulmonary emboli. May have a slightly elevated heart rate, but nothing really alarming. Red flags: unilateral swelling, progressive over days, tachycardia, mild exertional dyspnea, no trauma, age greater than 50, sedentary periods at work. Important point, no PCP access, which is of course a growing problem. Chain of events: clot begins in the deep veins of the calf. The patient ignores early warning signs, early swelling. The clot grows, small fragments begin to break off. The patient notices mild shortness of breath but dismisses it. By the time it reaches urgent care, the leg swelling is the least dangerous part of this story. We're worried about a pulmonary embolus. Ultrasound generally not available in urgent care or primary care. You know, uh, typically you would see in the scenario and you think, well, and I've had this arise before. The question is, if you're in a setting other than the ER, are they willing to order an outpatient ultrasound, outpatient lab, and potentially outpatient CT? If they're concerned about a pulmonary embolus, there's a good chance that they're not going to do that. And if you're sent over to a freestanding ER, they may only have potentially bedside ultrasound for fast scans, which stands for focused abdominal sonographic test. This is mainly just the bedside ultrasound looking for free fluid in the abdomen after trauma patients. And that clinician may or may not feel comfortable doing that to rule out a deep venous thrombosis of the extremity. And that's not to be confused with the formal ultrasound where someone is sent to the radiology department of a hospital and a radiologist reviews the study and then issues their report. So again, does the hospital have an OB department? If they do, they've got 24/7 ultrasound with a radiologist to read the ultrasound results. Outcome: at the ER, ultrasound confirms a proximal deep venous thrombosis in that leg. CT scan shows small bilateral pulmonary emboli. Patient is started on anticoagulation. If PE is present, generally this is going to be an admission for me. If it's just a DVT of the extremity and the patient's stable, home with close follow-up, which can be a problem because of a lack of primary care access. Closing message: unilateral swelling is never something to ignore. If you also have shortness of breath, even mild, the danger is no longer in your leg, it's in your lungs. Consider which facilities have ultrasound capability. Beware of patients who have other comorbidities that can cause dyspnea or shortness of breath. Examples would be congestive heart failure or chronic obstructive pulmonary disease, COPD. Always consider PE. You can have one of those conditions that does cause chronic shortness of breath, but you may have a pulmonary embolus on top of it. In closing, if this is the kind of content you find helpful, please like and subscribe. If there are topics you would like to see covered, you can email me at medicallogistics101@gmail.com. Remember, the danger isn't always what you know, but rather what you can't afford to miss. Thank you.